There's a strong evidence before our eyes that climate change will affect health and well-being of all people, and that vulnerable populations will be the most affected. This is a direct result of exposure to extreme weather conditions that includes increasing heat waves, floods, and wildfires. Health will also be significantly affected by food insecurity due to crop failures and impacts on livestock. Climate change, therefore, may lead to the spread of climate-sensitive pathogens.
Recognizing that climate change is the single biggest threat to human health, global actors at the intersection of those two areas have coined the saying that health is the human face of climate change. We must strengthen scientific evidence and advocacy to secure climate funding and support adaptation, mitigation, and resilience in health and associated areas. So I'm very glad that this conference offers us the opportunity to discuss and exchange knowledge from different disciplines on how to design and implement multi-sectoral action for climate adaptation and mitigation while building resilience in health. As I've already said, health is a human face of climate change. We must protect that human face and not allow climate change to disfigure it.
Climate change and health are the two most pressing issues facing African countries today, as we have heard from Dr. Murthy and other speakers today. Building more resilient health systems can create communities more resilient to the impacts of climate change, but reducing greenhouse gas emissions will have many benefits for improving the health of people in our countries and across the globe. These are the actions we can take to treat some of the symptoms, but we have not cured the patient, our planet, from its fever. And climate clock is ticking. Now is the time for climate action here in Botswana, in Africa, all around the world. And we as European Union, we stand with you and join that action as I speak here today.
On behalf of the Climate Health African Network for Collaboration and Engagement, abbreviated as CHANCE Network. The CHANCE Network is an output of the ENBEL partnership. ENBEL meaning Enhancing Belmont Research Action to Support EU Policymaking on Climate Change and Health. The ENBEL project has a focus on knowledge translation for the emerging research on climate and health. The ENBEL project has 17 partners across Europe and Africa, also including the 3 leading African research institutions on climate, environment, health, which is the Vets University in South Africa, Aga Khan University in Kenya, and the Investor Botswana. Given the importance of taking action on climate change for health, the European Union or Commission wanted to fund a project that could engage with academics and stakeholders to ensure that evidence on health impacts was communicated more effectively and translated to policy. So a key objective of the ENBEL project in Africa was to establish such a network, which is the CHANCE Network. This network aims to develop synergies in African climate and health response, also in advancing policy making across the region, facilitating evidence-based knowledge exchange, learning and operation, and also providing technical support for national or regional application for funding for climate change and health programming and research. The network covers 4 research areas in relation to climate change in Africa: extreme heat, air pollution, maternal and child health, and infectious diseases, as well as climate finance. Our members includes people working in the local and national government, research institutions, climate services, humanitarian organizations, NGOs, and private individuals with an interest in climate change and health. The CHANCE Network has contributed to key events in Africa, including the COP27 Africa Regional Resilient Hub, which was led by the Climate Development Knowledge Network. Also a policy session which we partnered with WHO Afro-Clim Health at the COP27 WHO Health Pavilion. We also contributed to the 2023 Africa Health Agenda International Conference in Kigali, Rwanda. The network also has contributed to supporting climate services and heat planning.
I wish to assure you all that the Ministry of Health of Botswana is and will continue to be a strategic ally in support of the Chance Network.